Health coaching is an important aspect in terms of self-management because even though it's the patient that's responsible for making and sustaining those changes, it's oftentimes the healthcare professional that can help get them engaged in terms of starting those changes. And of course, people need motivation, they need guidance, they need support in order to keep up those changes. We have, for instance, introduced many programs of chronic disease self-management. The Stanford-based program is probably the most famous, which is available in like some 40 countries around the world, which really works to train patients to take on that role of self-management. The problem we're finding is that, in fact, patients can oftentimes start some of those changes, but they may not also always know what are the best choices to make. They may not also know some of the best ways in which to get to those changes, so the tools for managing their health. And thirdly, they need the ongoing support from their healthcare professionals in order to stay on track. So without the healthcare professional coaching, they may not get started in those changes, and without the healthcare professional coaching, they may not be able to deal with the barriers as they begin to experience problems in making those changes, or they may not be able to sustain them over a long period of time. So the role of the healthcare professional as a coach is really an essential part. It's like any other kind of a behavior. I mean, if you think about it in terms of physical activity, what's the role of the coach? I get you started. I give you the right kinds of drills and exercises to do. I motivate you to keep you on track. I help you to make it fun. And then I come back periodically to make sure that you're on track. The same in terms of health and the same in terms of managing a chronic disease. That's the role of the healthcare professional in being a health coach.